The last 8 months, as you all know very, very well, we've had an extraordinary experience. We actually have seen in this health system over 85,000 COVID patients. In fact, some people think it is over 100,000, well over 100,000, since we did not do any testing, which we couldn't do for the couple of first weeks. So we probably saw well over 100,000. And what we did during that period of time was pretty extraordinary. You know, the character of Northwell came through successfully. The character of all of the individuals we have came through successfully. We did extraordinary work. And each and every one of you were directly involved in it. But then you went above and beyond. We asked for people who were willing to help in other parts of the country. And you responded. And you went to Georgia. You went to Puerto Rico. You went to Texas. You went to Utah. The feedback from all of those places was absolutely unbelievable. I got direct feedback about the quality of the people, the character of the people, the personality of the people, the compassion, the dedication, the competence, and that's basically all of you, and those that were not able to make it today. So this basically is a very, very brief celebration, and there will be other speakers, is to say, on behalf of everybody in the health system, all 73,000 employees, from the Board of Trustees, and Michael Epstein, who's chairman of the Board of Trustees, is right here in front to show his respect and dedication. Another board member is Mark Claster, who is here in the back, and Ralph Nappi over on the side there. He doesn't want to sit inside the tent with the rest of you. He decides to sit outside the tent. For those of you who know Ralph, we make jokes about Ralph all the time. From the collective Northwell, and quite frankly from the collective community of this region, and on behalf of the communities and the places that you went to serve, we say thank you. You are indeed very, very, very special people who do special work, and we just wanted to say we recognize it, we appreciate it, we understand it. And I know many of you, I spoke to some of you before I came up here, and some of you had been to multiple places. You just didn't go to one place. Some of you went to 2 or 3 different places. And that just indicates the type of people we have working at Northwell and the kind of people that do the work each and every day. So on behalf of everybody, my role is pretty simple here, is to say thanks. Okay? So give yourselves a round of applause.
My name is Randy Howard from Huntington Hospital. On September 20th, 2017, Hurricane Maria hit the island of Puerto Rico as a very powerful Category 4 storm. The storm raked across the island, sparing nothing or no person of its effects. Destruction was widespread. As part of FEMA's response, medical assistance teams were deployed. These medical teams are very lean and require rotation of personnel. Soon after the medical teams deployed and began their missions, they requested help for more personnel. Governor Cuomo offered assistance through an augmentation program, and of course, Northwell Health was quick to raise its hand to help as well. On October 4th, initial notifications went out to interested Northwell volunteers, and on October 6th, the mission was confirmed. 72 hours later, the 27-member medical team from Northwell was wheels up en route to Puerto Rico. Once there, our team received initial briefings and our assignment at the convention center. And the next morning, we were on our way to HEMA San Pablo Caguas Hospital. During our trip to Caguas, we saw firsthand the destruction, and it was very humbling. The hospital we supported was operating off of generator power since September 20th, and the local citizens were lined up to receive care. It was clear that the hospital was overrun, and the existing medical assistance team was providing decanting operations for the hospital. which we quickly assumed. We cared for several critically ill patients during our time there, expertly fulfilling our mission. Additionally, we sent smaller strike force teams out into the community to care for those who couldn't travel to us. The local citizens were extremely grateful for our medical support, and they told us over and over again, many times running up to us and hugging us, that we made them feel like real Americans. Sometimes they felt that way for the first time. For us, performing this necessary work was very rewarding. And from the moment our volunteers raised their hands, through the time we received debriefings back at 2000 Marcus, the entire team demonstrated complete professionalism, compassion, and caring. There wasn't an ounce of fear in the entire team. We simply wanted to know what we could do next. While constantly facing very challenging situations in austere conditions, the team demonstrated Northwell values. I could not have been prouder than to work with this great group. They made my job as team lead very easy. Further, it was extremely reassuring to know the entire organization, Northwell, was supporting us. Whether it was the extremely large quantities of food and equipment we received from Phyllis McCready, or the daily phone conversations I had with Gene Tagney, we knew we were supported the entire time. Northwell's response to this and other crises is demonstrative of Northwell living its values, and it's neither easy nor inexpensive to support disasters, yet Northwell proceeds with humanitarian missions regularly, which truly separates it from other hospital systems. In fact, it was the work of the 2017 cohort, our Puerto Rican mission, that set the tone for future missions. Little did we know then what would lie ahead for the future. Northwell again rose to the challenge in February of 2020 when a new cohort deployed to Puerto Rico to provide behavioral and mental health services following that island's devastating earthquake and the aftershocks that followed earlier this year. So I'm going to read the names of the first Puerto Rico cohort, and I would ask my teammates after I read the last name if you would stand, and if the rest of the audience would hold your applause until the very end. So again, help me honor Stacy Baroa, Janine Brown, Nancy De La Salle, my chief nursing officer, Francois Edmond, Emily Fawcett, Shaz Ganji, Keisha Guerrero, Bill Hastings, Dr. Nick Hernandez, Jonathan Izureta, Mike Keller, Bobby Keebler, Dr. Bill Lowe, Danita Owens, my consigliere, Eddie Reyes, Cindy Rivera, Lauren Roth, Melanie Rojas, Gary Sapesla, Dr. Phil Underwood, and Nashia Williams.
On December 28th, 2019, a powerful swarm of earthquakes rocked the island of Puerto Rico and continued to do so over the next weeks and months. This on the heels of the devastation of Hurricane Maria and the great work that the 2017 cohort did. Schools, homes, churches along the southern coastline crumbled. Hospitals were evacuated. Families were without shelter, food, water, but not just the physical world had been shattered around them, so had their mental world. Having experienced so much trauma and dislocation over the prior 2 years on that island, the families and communities were facing enormous uncertainty, worries, and stress. The need was great, and a call for help was made. Who answered this call? Northwell did. Northwell's behavioral health clinicians, Northwell's psychiatry residents, Northwell leadership. And why? Well, as Mr. Dowling said, because that's what we do. We go the extra mile We're nimble, we're global, we're generous, and as mental health clinicians, we seek to bring healing to those on the front lines. For 5 days, our teams walked from house to house for the families that were still living in their homes or near their homes. They listened to the stories. They identified cases of anxiety, depression, PTSD, and provided important referrals as well as human support and comfort. Our teams also visited makeshift schools, most of which were jerry-rigged in parks. They listened to the stories of children, many of whom described difficulty sleeping, waking up anxious or panicked about the next earthquake. One of our team members said, quote, "If children are afraid to go inside school buildings, it is not enough to rebuild concrete walls." So the team taught the children relaxation and stress management techniques. They did diagnostic assessments, identified a subgroup of children who were experiencing significant psychiatric distress, and helped put them in contact with local resources and care options. Behavioral health needs of communities experiencing disaster are often overlooked, but not last February in Puerto Rico, thanks to our team. We're so proud of each of you for your willingness to serve, to sacrifice, to travel, bring hope and healing, and to represent Northwell as you did. I'm now going to read the names of the team members who participated in that mission and ask that you all stand once I've finished reading all the names. Elizabeth Ayala, Elizabeth Guevara, Eva Levy, Alexander Padron, Paloma Reynoso, Eddie Reyes, Vivian Ruiz Villalobos, and Jessica Stacco. Thank you for each of you. And also to acknowledge Carolyn Sweetapple, our administrative lead, and really without her support and energetic just engagement, it would not have happened. Thank you, Carolyn.
I first want to start out with somebody very special that could not be here with me today. A very good friend of mine, one of my dearest colleagues, but most importantly, my mentor, and that's Mary Mahoney. And you'll hear a little bit why in a few minutes, but Mary's up in Albany right now doing what we've been doing for the last 3.5 months, and that's testing and doing some really great work in our communities. So I'm going to set the tone real quick. Out and about doing our things as we normally do, we start to get the word that we can't do any community events, we can't get out and do certain things. You have to think, and you have to think quick. You know, how do you reinvent yourself quickly during a COVID pandemic? So we start thinking. I saw a couple of the things that were going on, and one of them was fit testing. So I said, all right, I used to do fit testing. I used to work in nursing education, and I was taught that. I can teach my team. Let's go out and fit test. So made the couple of calls. There we were. And with that, I'm proud to say we fit tested over 8,000 employees in about 3 weeks. So I want to say thank you to my immediate team for jumping in and really helping. Secondly, again, where the tone is with Mary, bringing back Mary, and I wish she was here today because we've had a lot of great laughs. But while we were fit testing, I seen Mary one day at one of the sites, and she said, Eddie, you know those hand sanitizers that you hand out in the community events? I said, yeah. She said, I think that this is a really good thing for you. We're starting to test the first responders in Nassau and Suffolk County. Why don't you come with some of your team members and let's give out those hand sanitizers? I said, all right, this is great. In the meantime, I said, you know, I better order a lot more because I know we're testing a lot of people. So we ordered about 10,000 of them. So fast forward, next thing I knew, we were testing in all of the communities with Mary, and it's our claim to fame is how she brought us into testing was those hand sanitizers. So we laugh a lot about that. So we start testing. We do a lot of different communities where we start now testing in faith-based organizations across the entire Long Island, New York, Harlem, Manhattan. And we found out that people really needed our help. And these were communities of black and brown color that were kind of left behind. And this was part of our mission to get out there and help our communities. So again, fast forward, get the call from Jean and Mary one day saying, what's going on? How's everything? Oh, everything's good. I'm in Harlem testing today. Oh, good, everything's going good. Yeah, fine. Why, what's up? Well, the governor asked us to go to Texas. So I said, all right, great, figure that out. And I said, all right, just let me know what we need to do. She goes, we leave tomorrow morning. So I was like, all right, this is good. So we were the first group to go out. The Houston trip was first. Very blessed to be part of it. We had a little inside people in the Houston mayor's office, thank God. My brother-in-law is actually the chief recovery officer there. So we were able to get into the mayor's office very quickly the second day we were there, and able to look at maps and hotspots and find out where we really needed to test. So that's why we were able to get in very quickly, get a couple of churches set up, and off we went. A great experience. We helped a lot of people. The pastors were so passionate and thankful that we came out to Houston. But most importantly, my team that came out to Houston was just very special because, again, we were the first ones to go out, so this was very quick, happened very quickly. There's a couple of things I want to say about our team. No matter what we asked them to do, what we were putting them into, it was never a question. That takes a lot in a person. And Michael said it perfectly in the beginning. It says a lot about who we have here at Northwell. So I just want to make sure that we recognize that these are gifts that we're given every day, and I considered my team gifts. So before I read off the names of my team, I just want to leave with a quote. And there's not enough words from someone who prides himself or herself on words for every occasion to say thank you for your diligence, sacrifice, and determination during such an event as we are facing now. So in light of a far better phrase, thank you. You are our modern day heroes, so thank you very much. So at this time, I will ask the same, that we wait till we call the names, and then applause, and then we'll ask them to stand up. I only have one of my team members here, so she's really special today. The rest are nurses, and I'm going to read their names anyway. I'm going to tell you where they're from. Christine Chan, she's from Manhasset Hospital, could not be here today. Lauren Henry, LIJ Medical Center, also could not be here today. Anjanette Rosario, Manhasset nurse, same situation. And Timothy Verhey, Manhasset Hospital. But I do have Shiny Paul with me today. One of our stars that really helped us get through our trip in Houston. So please stand and applause for Shiny. Thank you very much, everybody. Have a great day.
Hey, good afternoon, everyone. My name is Vincent Cunningham, and I am the Regional Director for Community Relations in the Western Region. I actually work for Ed Fraser. So I woke up on a Sunday morning, and I got a call from Ed, asked if I'd be available to join the Savannah deployment. Immediately, I knew it was time to serve and answer the Northwell call. With my wife and I recently finding out we were expecting our first kid, I have to be honest with you, in the back of my mind, I thought it could be a great vacation. So immediately upon meeting the team at our hotel, I already knew the trip would be a success. It was as if we formed a bond before even knowing each other's name. From our initial meeting with the state until the minute we left the city, the bond grew and the team blossomed to the point where we were eating dinner together almost every night, taking tours through Savannah, and even a trip to Charleston. I think my colleague Christine and I would both agree that we had a consummate team of empathetic clinicians who approached each patient with care and friendliness to ease their anxiety of having to test. Without the cohesiveness of this team, it would have never been as successful of a trip. Made for This is an incredible employee motto. From the minute I heard the expression, I always knew all of our employees were made for this. The COVID pandemic has been a litmus test for the motto, and we have obviously shown through. To have a team become such a tight unit on a difficult mission in a strange city in such a short time cemented that we are all made for this. We are New York tough and will always be. It is something that's built into our psyche. I believe that is what makes everyone in this organization made for this. And I'll end with this. There are 5 W's in journalism: who, what, where, when, and why. Northwell employees only ask one of those questions: when? So I want to thank Michael Dowling, Gene Tagney, Mary Mahoney, Eddie Fraser, Andy Roberts, and the rest of the corporate team for support throughout the deployment. Also want to thank Andrea, Barbara, Chris, Karina, and Kathy, and obviously Christine for their hard work, friendship, and dedication to the mission. It's a trip I'll never forget. So please welcome Christine Black to recognize the team's efforts and dedication to the Northwell Health mission.
Good morning. I'm going to read the names of the team. If you can hold your applause to the end, and if you guys can stand up when I'm done. Andrea Hall, Christopher Haggerty, Barbara Scheffler, Kathy Caesar, and Karina Kando.
In August, 3 separate cohorts deployed to provide support to our fellow healthcare heroes at Intermountain. Although separate in deployment, these 3 groups will be forever linked together thanks to an incredible once-in-a-lifetime experience. On behalf of myself and the other 32 brave men and women, I would like to say thank you to Northwell for the opportunity and to Intermountain for the warm, gracious welcome. They made the entire team feel safe and part of their team. Although we worked hard, we had an opportunity to experience some of the wonders of Utah. We enjoyed time as a team hiking in the mountains and exploring the city. We also enjoyed what I think is the best of Utah, the flavored soda and the cookies. One of the team members said that spending time away with this team on our deployment mission was very healing. And another team member said, "The best part of Utah was the teamwork. We worked without bias to achieve our goals and support each other in our journey. Utah was the best experience of my professional career." I, as well as George Weldon and Andy Roberts, standing up here with me today, very much echo these sentiments. I want to give a shout out to Wave 2. Thank you for the wonderful 2 weeks. You are the best team. And I want to thank Northwell for the experience. Now to say a few words is my colleague, George Weldon.
Good afternoon. So, it's a little spin. Hopefully some people will remember this TV show. So, this was a true story of 11 strangers picked to live in a hotel, worked together for a common mission, and had their lives captured in photo snippets. To find out what happens when people stop being polite, AKA no mask, social distancing, and start getting real, safety precautions versus hospitalization. So hopefully I do not get sued by MTV for copyright infringement. I see a few lawyers in here, so I may have to tap you. So here at Northwell, there is a culture of care message focusing on needs. The message focuses primarily on the needs of our patients. However, I found it a fitting topic to focus on for my speech. First, I'd like to begin by expressing my sincere gratitude to Northwell Health for taking a stand against social and population health crises and emerging as a global leader, unafraid to go into any challenge to support the greater good. I'm proud to be made for this. Taking it a step further, and the reason why we're all gathered here today, I need to say how impressed and grateful I am for the opportunity to work with the amazing team of Northwell nurses of the 3rd Wave deployed to Salt Lake City, Utah. This is truly a distinct group of outstanding nurses who have gone above and beyond the call of duty. Also, I'd be remiss not to mention a note of gratitude for your families and our collective larger teams who were supportive of the decision to volunteer 2 weeks of your lives to aid the Intermountain Health System. So a quote by Eleanor Roosevelt: "We gain strength, courage, and confidence by every experience in which we really stop to look fear in the face. That's what heroes do. They face fears most people feel helpless to defeat. As a child, I used to think I knew what a hero was. I had this mental image of some superhuman with extraordinary powers far greater than any common earthling. As a teen, my view of a hero became a more respectable and adult-like definition, whereby a hero was a known public figure who did something pretty outstanding. But as I stand before you, my definition of a hero has changed yet again. The past few months, and without any doubt, from August 30th to September 13th, have solidified the definition of hero for me. I'm reminded by the fact that a hero is someone who has given his or her life to something bigger than oneself. Today, I see a hero's cape on the backs of every extraordinary person I had the honor of working with in Utah. This group of nurses before us battled through some of the highest volumes of COVID across the globe, and then signed up to help some more just a few months later. There is no question that you're all made for this. This traumatic experience has opened my eyes to the fact that I've been personally guilty of occasionally taking for granted the importance of the work that you all do. Sadly, I think we all can be guilty of this from time to time as we get so consumed with our own stuff. In the name of our Culture of Care message, I need to thank you, thank more of you, more often, and for no reason other than the fact that I know you're doing a hero's work day in and day out. And so, in closing, I chose to put a spin on the Culture of Care message about needs. I'm a firsthand witness to the fact that these nurses always put their patients' needs first. And what I've hoped to accomplish in this speech was highlighting the need to regularly express gratitude to our healthcare heroes. Today's event is an important reminder of that. And to the third wave that went to Salt Lake City, there were too many moments to highlight and memories made to recognize in a 2-minute speech. I genuinely want to thank you and say how grateful I am, once again, to have been a part of this mission with each of you. We arrived as strangers, departed as colleagues and friends, bonded for years to come. So with that, to help me honor these amazing cohorts, please welcome my colleague, Mr. Andy Roberts.
Good afternoon. I really have to echo the sentiments of Amy and George. Really appreciate everything that they did, especially Amy, because they told me I couldn't go home unless somebody came out to replace me, and Amy was that person, so I'm so happy to know her. But I really, I can't thank all of you enough. I mean, to hear the work that Randy and the team that went to Puerto Rico have done, and then for me, it was one thing being, I'm not a clinician, so I mean, the fear for me was of facing COVID. But within, minutes of spending some time with the Wave 1 team and hearing the stories of what they experienced, the courage that they had was not just about coming back and facing COVID-19 in the eye again. It was facing patients in the eye, the fear, bearing witness to the tragedy and the death that they experienced was, it took my breath away hearing those stories from them. And I mean, they just defined courage. For them to be willing to go back to the front lines, I was just immediately touched by that, and it made me so proud to be part of this organization. You are a testament to what Northwell Health is all about. And I think beyond that, with so much that's going on in our country right now, it's to see what you did, the willingness to serve others is a testament to the rest of our country. And it represents how good this nation could be when we're starting to commit and think about others. And I'm just so proud to have been part of this. I have to recognize there's an incredible amount of support. There's a great support team. Went to all these deployments. There are people that are behind the scenes that do a ton of work, and they don't get the glory necessarily of having their pictures in some of these highlight films. But we couldn't have done this without them. And I appreciate George recognizing the families. I know there was a lot of sacrifice from them. Kids missing parents and loved ones missing their family members. But we really couldn't have done it without you. And now I have the honor of reading out the names of all of our volunteers. And I will say quite a few, but you don't have to stand up until we're done. So we'll just wait till we get them all done. Okay, Adara Abramson, Marissa Allen, Evgeny Antonov, Sharia Barbera, Kayla Blackburn, Marissa Baraccia, Marie Chen, Jay Chung, Nancy De La Salle, Craig Ferrara, Christian Gabara, Mary Hurricane, Edward Howard, Shahzadullah Khan, Ronnie Kavovitz, Shmuel Kramer, Christy Leck, Magdalena Litwenchuk, Amy Marshall, Patrick McGinnis, Madison Montague, Jacqueline Pickering, Deandra Ramkaran, Christina Rodriguez and Christina Rodriguez, Jeffrey Rosa, Juju Sabu, Anise Sterling, George, Brianna Warona, Letitia Yard, Carolyn Doyle, Jennifer Grasso, Peter Kelly, Susan Kwiatek, Jackie Morales, Paul Pedretti, Jonathan Plissner, Amagna Signorelli, Jackie Thanasis, and Jill Zimbera. Please stand.
So thanks so much to our leaders who presented this morning. And thank you to all of you for bearing with us. I think we're sort of used to it at this point with the social distancing and so on, but we of course tried to do this event in a way that acknowledges you, recognizes you, but then of course still allows us to be COVID sensitive and keeping each other safe and allowing ourselves to still be responsible while holding an event like this. So of course, with that, we don't get the opportunity to bring you all up on stage and take pictures in that way. So what I'll do for the rest of the audience is at least show you some of what our heroes are receiving. So first, this great extra mile pin. And by the way, this is in addition to whatever they received immediately following their respective deployments. So it's the extra mile pin, which we certainly invite you to wear on your units, etc. Or wherever you work, a great crystal sort of memorabilia, which you can, they'll also have to take with them. A certificate of recognition signed by Michael Dowling. And then lastly, a letter of gratitude. And so that's some of the items that our heroes will be taking home with them, in addition to a copy of Michael's book, Leading Through a Pandemic, which you were all a part of. And so we, once again, thank you for all of that. A couple extra additional people just to thank, and then some closing remarks. We would be utterly remiss not to thank some of the people that really make these deployments happen, so that our heroes can go out and do heroes' work. And so a truly heartfelt thanks to the following. Maureen White for her leadership, Jean Tagney, the entire emergency management team, Mary Mahoney, Scott Strauss, Jim Romanelli, of course, our friends in procurement, Donna Drummond, Phyllis McGreedy, that certainly make sure you all have everything that we need when we do get deployed. And then again, our site leadership. The ability to send this many team members out to a place isn't without its impact within our own facilities. And so the ability of those leaders to just really roll with it and figure out how to continue to maintain the staffing necessary to care for our patients and our communities, it truly takes a village, and every single one of these is representative of that. In addition, just to call out some names of some of the people who handle some of the tactical pieces of that: Pat Brown, Lorraine Chambers-Lewis, Cheryl Davidson, Carol DeSanti, Melissa DeFalco, Carolyn Doyle, Alexa Friel, David Gill, Jennifer Grasso, Judy Howard, Elizabeth Hughes, Peter Kelly, Matthew Kurth, Susan Kwiatek, Kelly Lawton, Jackie McCarthy, Rebecca Mayer, Jackie Morales, Paul Pedretti, Jonathan Plisner, Andy Roberts, Amanda Signorelli, Lara Sharari, Jackie Thanasis, and Jill Zimbera. So if we can give them all a round of applause, that would be terrific. And so I also do want to send a special thank you to Lara, Melissa DeFalco, David Gill, who helped us put this event together in very short notice. So thank you to them, and thank you for all the special considerations that you see around us today to keep us safe and responsible. What I'd like to do is also call out the title of this event, The Extra Mile. I love the creativity of our team to come up with that name for this event, in particular because when you think about what that denotes, the extra mile, typically your mind will often be drawn toward the struggle, the challenge, the strain, and then the true willingness, the ability to dig deep to go that extra mile, whether that's on a long journey, whether that's a run, a workout, but it's this notion that you have something deeper. You can dig deeper and get more. because you can give more. And that's what this event really is trying to acknowledge and thank all of you for. That ability after you had this strain, possibly loss, fear, you heard some people talk about, but to dig deep, to go more, to offer it, and in this setting, to offer more care to others who needed it more than we did at that moment in time, truly talks a lot about, and you heard all of these words by the speakers before me, your character, the character of Northwell, the culture of Northwell, the values of Northwell, the values of you, and the reason why we value you so much as team members within this great organization, and value you as healthcare providers. I think there's no better way to sort of summarize it by words that exist right within our employee value proposition. And I'm going to read it for you because I think it sets the exact sentiment of what I just described. And it's in the second paragraph, and it goes as follows. It's not for the faint-hearted. God knows that is absolutely true from the last 8 months. It doesn't just take courage and determination to do what you do. It's that spark and that instinct to care that changes lives. Thank you to all of you for your courage, your spark, your instinct, your character that has truly changed lives. Thank you so much. Thank you for participating in today, and enjoy the rest of your day.